All right, let's jump right into the core rules of patient safety. We're going to cut through all the fluff and focus on the super critical, exam-ready info that you absolutely need to know.
First things first, let's get our heads in the right space with this quote. See, patient safety isn't really about having the fanciest new equipment. It's a mindset. It's a way of thinking, an awareness that you bring to every single thing you do.
So what exactly are we talking about when we say patient safety? Well, here's the textbook definition. But really, it all just boils down to two simple things: stopping harm before it can happen and cutting down any risks. It all goes back to that fundamental principle of healthcare. First, do no harm.
Okay, let's dive into our first core principle. This is all about nailing the fundamentals: identification, communication, clarification, because honestly, this is where so many preventable mistakes start.
So this is non-negotiable. Before you do anything for a patient, give a med, draw blood, you name it, you have to use at least two unique ways to identify them. And check this out. You can never use their room number or bed number. Why? Because those can change in a flash.
What about when you're taking an order over the phone, maybe in a hectic situation? You follow this three-step dance, no exceptions. You write it down, you read it back word for word, and you get that clear, yes, that's correct. This simple little loop prevents so many errors from just mishearing something.
And you better believe this is going to show up on your exams. When you see a question like this, the answer is almost always going to be about that readback policy. It's the gold standard for a very, very good reason. Now, for handovers between shifts, or when you're calling a doc, we've got SBAR. It's such a great tool because it gives you a clear, predictable structure so that critical info doesn't get lost. Situation, background, assessment, and your recommendation. It keeps the conversation focused and complete.
This brings us perfectly into our second principle: how we handle those high-risk situations. The ones where the potential for really serious harm is just so much higher.
You know, some medications are just riskier than others, and a fantastic way to remember the big ones is this mnemonic: pinch. If you're dealing with any of these, you need extra safety checks, like having a second nurse double-check your dose before you give it.
Okay, let's step into the operating room for a second. One of the most powerful safety tools ever invented is the timeout. The entire team, the surgeon, the anesthesiologist, every single nurse, everyone just stops. They hit pause to make absolutely sure they have the right patient, the right procedure, and the right surgical site.
And here is the key detail you have to burn into your memory. When does the timeout happen? It happens right before the skin incision. It is the absolute final check, the last chance to catch a huge error before it's too late.
All right, principle number 3. This one is all about what many call the single most effective safety measure in all of healthcare. It's simple, it's cheap, and it literally saves lives.
We're talking about hand hygiene, and it's not just about when your hands feel dirty. The World Health Organization defines these 5 critical moments. You have to clean your hands at these specific points of care to break that chain of infection.
So, do you use an alcohol rub or do you head to the sink? Well, it depends. That alcohol rub is great. It's fast and effective when your hands aren't visibly dirty. But if you can see any dirt, or, and this is key, if you're dealing with spore-forming bacteria like C. diff, you have to use soap and water. No way around it.
You know, infection control doesn't just stop with your hands. How we throw things away is a huge deal. And it's all about the color coding. Yellow is for things like blood bags. Red is for your plastics, like tubing and gloves. White is for sharps, needles, blades. And blue is for glassware. Getting this right protects you and everyone else.
So even when we do everything right, emergencies can still happen. So let's talk about what to do in 2 of the most common ones: falls and fires.
With falls, it's all about prevention. And look, these aren't complex, high-tech interventions. They're the simple things that work. Keeping that bed as low as it can go, making sure the call bell is right there, and having the side rails up. These things make a world of difference for at-risk patients.
Now, if you discover a fire, your response is simple. Just remember the word RACE. And the order here is absolutely critical. What comes first? R, for rescue. Your number one job, before anything else, is to get your patient out of immediate danger. Then you worry about the alarm, confining the fire, and extinguishing it.
And if you do get to the point where you need to use an extinguisher on a small fire, the steps are just as easy to remember. PASS. PASS stands for pull the pin, aim the nozzle at the base of the flames, that's crucial, aim for the base, squeeze the handle, and sweep from side to side. It's a simple system that's designed to work even when you're under a ton of stress.
Okay, we have covered a ton of ground here. So let's boil it all down into a quick, rapid-fire summary of the absolute golden rules you need to walk away with.
Here they are. If you remember nothing else, remember this. 2 patient identifiers, always. Read back those verbal orders. Time out before surgery. For fires, it's race and pass. And for falls, prevention is everything. This right here, this is the heart of patient safety.
And that brings us to the final, most important takeaway. Whenever you're not sure what to do, when you're facing a tough choice, just stop for a second. Ask yourself this one simple, powerful question. What is the safest action I can take for my patient right now? That question, it will always lead you down the right path.